I don't think I've ever been more excited about what healthcare could be than right now. In my career, I don't think I've ever seen as much openness to change. I don't think I've ever seen as much focus on quality and safety as we have today. And so I think one of the most exciting things about this initiative is that we have the freedom to do it different. We have the freedom to reinvent it, and you will be the leaders on the edge of making that reinvention. And I think that when you look at what our mission calls us to do, one of the key words in our mission is healing. And I don't think there's any way we can really effectively heal unless our patients feel that they are in a safe environment, if they are in an environment where quality and safety is a major priority. And I think what we've learned over the most recent years is that just because we are individually very competent clinicians doesn't mean our patients are safe. And it doesn't mean we'll deliver good quality care. And that healthcare has become a lot more complicated. It's become a lot more complicated because of our patients' chronic illnesses and all the sort of synergistic complications that are associated with that. And it's become more complicated because we're more specialized. And so more than ever, we need safety systems in order to protect our patients. And so this is a key part of our strategy at CHP, and it's a key part of our mission going forward. And you are the leaders in really helping us do that. And so I guess it's always important to remember the journey we've been on. And this slide shows that you've done extremely well in making progress in terms of reducing harm to our patients. But well isn't well enough. When there are as many errors that we could avoid as there still exists, we know that if safety becomes a higher priority, if we invent those new systems, if we function more effectively as a team, if we function more effectively using technology, actually, I know some of your concerns when you take on something like this is another task. But another way of looking at this is an opportunity to change the tasks so that in the end there may be fewer tasks. Work may actually work better. When you think that all the different things that go on when we deliver care, a more holistic team view to identify ways of doing things differently is a tremendous opportunity. And this next slide sort of helps remind us what the opportunity is just at CHP. This is the quantified opportunity if we went to zero at CHP. There are still 3,870 errors that we could avoid. So this isn't a speculative idea. This is a quantifiable number. And the incredible thing about this is that every one of them is avoidable. And so while we've done well, there still is a tremendous opportunity. And as we look in our communities and at the burden that healthcare costs are in our communities, if we could eliminate 20,000 excess days, if we could eliminate $26 million due to variable costs that come with that, the effect on the overall strength of the ministry going forward, and it's perhaps the most important statistic is the last one, that a harm patient has a 14.5% mortality rate. And so these are some pretty compelling reasons to get excited about wanting to reinvent how we do this and finding better solutions as teams for going forward. I think another critical aspect of our going forward is realizing that safety is really embedded in all aspects of what we do. And so you could call this a high reliability slide, or you could call this CHP's strategic plan. And I think that if you walk through everything from strategic partners to care redesign to leadership to people and culture and technology and equipment, those are all strategic initiatives. Those are all areas that we are emphasizing in the current strategic plan at CHP. And in every one of those activities is the importance of safety and reliability being embedded into the organization, so that we make sure to spend a lot of time on safety and quality in our board meetings, making it a high priority for leadership at that level. We create CEO leadership academies for those of us that are a little slower in picking up the importance of this issue. So, you know, it is the only way we start embedding it in the organization. The care redesign opportunities that we have are quite significant in terms of making the care we deliver safer and more reliable. And so I think the phase we've been in, what has got us where we are today, has been a focus on evidence-based medicine and educating each other about the application of evidence-based medicine. But the phase we need to get to is we need to have it adopted reliably and consistently every time, every place, for every patient. And that's a lot more challenging than just saying this is the evidence, we'd like to follow it. And so really that won't happen unless there is a very concerted, disciplined effort to make that happen. I would also say that, you know, I know some of your concerns are strategic partnerships. How well will this be received by physicians? And I heard an interesting presentation yesterday that said that one of the most critical issues for physicians, in addition to quality, and I think they're absolutely committed to quality and safety, but I think their other high priority is time. And a lot of our systems take their time away. And a lot of our systems aren't reliable. And so if you view this as a way of actually giving them more time because the systems run more reliably, predictably, and consistently, this could be an opportunity that they would very much embrace once they understand it. Technology and equipment, I think, is a critical tool, whether we look at it from Epic as a technology that will help us share information real time, whether we look at it in terms of using command centers in all of our hospitals to really direct patient flow, whether we look at it in changing job descriptions so that we have care coordinators on every nursing unit, and they have technology that allows a simple communication real time between caregivers and patients. These are all things that can help advance this activity. But perhaps the most important of all is our culture, because all of these other things will not happen unless our culture is one that's committed to this. And so in effect, you're going to be our culture champions. And our culture isn't going to get better unless you help it get better, unless you believe passionately that this is what will make a difference for our patients, that, you know, this is what will best help care in our communities. And Steve made a point about the length of time that I've been with CHP, and I was with the daughters for 17 or 19 years, and I've been here almost 17 years. And I would say the most rewarding thing I have done in all of that time is this focus on safety and quality. And so I think that to have that be part of our culture, I think is something that we should all aspire for. And, you know, not everybody gets that excited about it. And I merely conclude they just don't understand. And so it's really important for us to help them understand why they should get excited about this. And you know, every person sort of gets excited about things with different sort of facts or emotions, or and so you just have to find what is relevant to this particular person in the organization. But as you can see, we've made progress on our culture, but our culture isn't anywhere near where we need it to have in order to get to the results that we're talking about as an organization. And so I know one of the questions I always get in this, well, will we have the resources? Will you support us? And I will say yes to that. I would also say you have a lot of resources, and you can create resources by better using the resources we already have. I think that the amount of money our society spends on healthcare is unbelievable. And the last thing we should be talking about is our lack of resources. It is really how well we use the resources that we've been given. If you look at the growth rate of our resources and the growth rate of almost any other sector in the economy, we're taking the resources from every other part of the economy. So it's really sort of how you frame it. And if you frame it as, I don't have enough resources, well, you're going to be unhappy. But if you frame it as, you know, we're getting a bigger piece of the pie than anybody else, can we figure out a better way to use it? I think there's a lot of opportunity on that side. And that's part of the culture, a culture that doesn't view barriers to finding opportunities for quality and safety, but looks at what we have and the many resources we do have and figures out how to use them more effectively to emphasize it. And I think that where I'd like to close is that it's, I think, a real tribute to all of you that IHI chose you to be the individuals that they wanted to bring this program to the United States. And I think that it's a recognition of the work that you've done so far. But again, I have tremendous gratitude that we have IHI as a partner. IHI is a tremendous resource. It's a privilege to have them working with us to do this work. They're going to teach us things and show us things and advance our learning that we wouldn't get anywhere else. And so they're sort of choosing you to help how to redesign healthcare for the future in this country. And I have complete faith that you will fulfill their judgment in selecting you for that partnership.